All right, guys, I finally got my power back up here with the internet. So I'm going to start with antibiotics. So a couple of the definitions from slide 2 to definitely make sure that you do go back over was in regards to what is synergistic, and that's when two things work better than one. And then we talked about the PAE, and that's the period of bacterial suppression that occurs after the antibiotic has been stopped. Therapeutic drug monitoring, again, is that anticipation of what do I want to see in my patient that's telling me that they are getting better from this medication. We talked about MRSA and VRE, and so these multi-drug resistant organisms, or MDROs, definitely these folks would be in isolation. The treatment for MRSA, the preferable antibiotic will be vancomycin. We do know that any antibiotic can cause C. diff, and that antibiotics will kill the good cells in addition to the bad in order, and when that when the good stuff is suppressed, then the bad stuff can take over, and that's like what you can see, these super infections and the C. diff and so forth. With the vancomycin, we did say that there are a couple things to be very concerned about with the vanco, and that was with the peak and trough. And if we see a trough level, again, that is too high, so above that anticipated range, then the patient has the potential for having that ototoxicity and nephrotoxicity. And then with the oto, patients could describe a ringing or that tinnitus or a hearing loss or dizziness. And for nephrotoxicity, I'm looking at those kidney functions, so the BUN, the creatinine, the GFR, the urine output. We talked about red man syndrome, also related to vanco, and that is not an allergic reaction, but more of a reaction somebody can get from the infusion going too quickly. So the minimum time you want to infuse vanco is 60 minutes. So the reaction that they can get is this flushing or itching of the head, neck, face, upper trunk. Okay. Looking at, let's see, one of the macrolides that we talked about was azithromycin and clarithromycin. And so when you would see clarithromycin, or one of these especially, is when we treat that bacteria, H. pylori, that can cause ulcers. And we know that if they're not treated, or that bacteria is not treated, then also that person can be at risk for stomach cancer. So with the treatment for the PPI, it is a combination of 2 antibiotics with a PPI. For the treatment of the H. pylori, it's going to be 14 days with 2 antibiotics and 1 PPI. They have combo packs, or sometimes it might be ordered separately, just depending on the cost for the patient. As with always, with all education, we want to tell our patients to make sure they complete all of their antibiotics, even if they're feeling better after a couple days. Let's see. We talked about Flagyl and how it can be pretty common antibiotic to be seen a lot of times for gynecology or gynecological infections or abdominal surgeries. C. diff sometimes will have that treated. One of the miscellaneous antibiotics as well was the nitrofurantoin, or the microdantine, and that we do see these a lot for UTIs. Double checking to make sure that the patient's kidney functions is okay and not impaired prior to giving it. One of the things too with the macrodantine is that we do like to make sure it's given with lots of foods, food or milk, or fluids, food or milk. And if you remember, we talked about antibiotics. There were some that it really suggested to take with a lot of water, because it can help to decrease that GI upset and just kind of counteract that side effect from those antibiotics. And then again, just through the nursing process is looking at those drug allergies, looking at all the baseline labs, vital signs, knowing what the patient's in there for, and again, thinking, always keeping in mind is what is that therapeutic reaction that I want to see. Always checking the 6 rates of medications, making sure that my patient's not developing any kind of super infection. Okay. I'm going to jump over to antivirals now. So we said that antivirals or viruses can be very hard to kill because again they get inside of the cell and have to be inside of that cell in order to replicate because they cannot replicate on its own. Okay, when we talked about viruses, that they can be bothersome, but a lot of times survivable, right? It can be very self-limiting. Some of the viruses that we know of, influenza, COVID-19 right now, that we do have some effective antiviral medications, and we talk about how how the viruses can enter the body. So there was through the respiratory tract, ingestion, mom to baby, inoculation, whether it's through the skin or mucous membrane. So again, inoculation is not always meaning that it's through an immunization. Inoculation is like that transferring, or think of something that's contagious and you come down with it. So that non-vaccination route, sexual contact, blood transfusion, organ transplants, bites. HIV we talked a little bit about, and just that again they are treated differently. They're treated with antiretroviral medications. When we're looking at the herpes simplex and the varicella zoster virus infections, so again, herpes simplex, you're going to have oral, which is the HSV1, genital is HSV2. Then you have the human herpes virus, which is the varicella zoster, or the VCV, and that is the viruses that people can have that would be chickenpox or shingles, CMV, which is cytomegalovirus, Kaposi sarcoma, but the ones that we're really more familiar with is with the chickenpox and the shingles. Okay. Okay. When it comes to antiviral medications, like I said, those are the ones for more just the viruses that we've talked about, not the antiretrovirals. Viral load prevention, so again, it is with the medications that are viruses that you can have blood work done to kind of see the amount of viruses that patient is dealing with and the effectiveness of the medication for them. The aim of antiretroviral therapy, again, is to minimize symptoms and infectivity as well as to shorten the duration of the illness. Okay. And how antiviral medications work is that they will impair the viral replication, and if I can impair it or block it or stop it, it's going to eliminate the virus. The immune system can kind of rally back and try to take care of things if we can stop it from keeping on replicating. Okay. As far as adverse reactions or adverse effects at antiviral drugs, they just vary with each medication. We do have a few different ones that will treat influenza, and amantadine is just for the influenza A, where your Relenza and Tamiflu will do A and B. All of them need to be treated, or started within 48 hours. And if somebody is not symptomatic but has come in contact with someone, then a lot of times that provider will go ahead and empirically start them on it just to lessen the chance of that person coming down with the flu. Okay. With the varicella zoster, again, with this one, the goal of the antiviral drug is to suppress the replication of that virus. So it can come in oral and it can come in topical. For oral, like I said, usually patients will know when they're starting to have an outbreak. So it is used to treat those outbreaks to help dry and cross those lesions over. If they are taking oral, they need to make sure they take all the medication. If they're using topical, good hand washing and wearing a glove in order to apply it. Okay. The acyclovir is certainly, I said, used for the human herpes virus. A couple things that is noticeable with the acyclovir, though, too, as far as side effects go, is that it can certainly cause headache, nausea, and diarrhea. So that, again, is an education point to teach your patients. The vaccination information sheet, or the VIS, it's just a document that you'll give to all patients when you give them any kind of immunization that tells them what it is. And again, the ANPI is pretty much the same as far as the antibiotics. Probably with this one is also just that education piece of how to apply ointments, that hand washing, that patients should be educated to start their antiviral medications at the earliest sign of any recurring episodes or outbreaks of the genital herpes or the herpes zoster. Okay. Therapeutic effects, again, how am I monitoring that patient that may have got an immunization or an immunization, antiviral medication. And I think that's really about it. All right, guys, have a good week.